Could you do some scenarios with wound care at the next webinar? I'm noticing a lot of those types of questions on the CPC practice exams, and I'm weak in that area. For example, an 11-year-old girl fell from a chair and received 2 3-centimeter lacerations to her left arm with embedded glass, etc. Face, leg, arm, they all need layered closure with wound repair. Some needed superficial repair, some needed a complex repair. So the first thing that I want to clarify when we're looking at this question is this isn't really wound care. Wound care is when we are providing care to the actual wound. Things like wound-vacs and packing and all of that. What this is what we call a repair. And this is really a laceration repair. Laceration is just that. It's a cut open on the skin, right? And it can go multiple layers down, all the way to the bone in some situations. But when we look at coding for repairs, there are really 3 factors that you have to know. If you were to go in your CPT manual and you go to the repairs section in the integumentary section, you're going to find that there are 3 factors that determine which repair you need. Can we scroll a little farther down? The 3 pieces that you need to know. First of all, you're going to have to know the type of the repair. Is it simple, intermediate, or complex? And when we talk about simple, intermediate, or complex, simple is just what it sounds like, simple, right? We're just closing it back up. We're using usually sutures to stitch it back up. Sometimes we're using butterflies, but it can't be something as simple as like Dermabond if you read through the guidelines ahead of there. Intermediate says it's a little more complex than that. We may have to do a layered closure. We may have to get some dirt and debris out of there. And a complex is, just as it sounds, really complex. We had to do a lot of extensive undermining. We had to get all this dirt and all this dead skin and all of this other debris out of there. We've got to do a layered closure. Maybe we have to do rotations, something like that. Then, in addition to knowing what kind, what level, right, how big of a deal is it, we need to know where are we repairing, right, the anatomical location. The third piece that you have to know is the length of the laceration. And your providers need to be documenting how big that laceration is. A good question I get a lot of the time is, well, what if my provider didn't say how big the laceration was? Well, they shot themselves in the foot. It's not that we can't code for it, but we have to go with the smallest size available. Because most of them will say, like, under 2 centimeters. Well, if they didn't tell us how big it was, all we can do, we know they had a laceration, we know we repaired it, and we usually know what level it was, but we don't know how big it was, so we have to go with that small one. So let's look. I've got a scenario here in my answer sheet that we're going to kind of talk through. A little farther down on the page. So we've got Martha. Martha's a 75-year-old female. She lost her balance and she fell. And when she fell through the storm door at home. She's got glass embedded in her right forearm and in her right hip. And she also sustained a laceration to her right cheek, her shoulder, and her knee. So we've got 5 different places that were injured, right? We've got the forearm, the hip, the cheek, the shoulder, and the knee. Poor Martha. She had a heck of a day. Her cheek laceration was 2 centimeters in length, and we closed it with sutures. Her knee wound was 5.5 centimeters. Her shoulder wound was 7 centimeters. And for the shoulder wound, we had to layer the closure. That should be, anytime you see a layered closure, that should indicate to you that you are going to have at least an intermediate repair. And what that means is they had to layer the closure. They had to close maybe muscle and then skin. So they had to do multiple layers. Her forearm was 11 centimeters. Wow, that's a big laceration. And her hip laceration was 4 centimeters. Both of those required cleaning and removal of glass. So again, had to do more than just a simple closure. The hip laceration we closed using layered closure, Vicryl and Proline, and the forearm was a complex closure with some debridement going on there. So when you go to code for this, what you're going to do is you're going to ask yourself those 3 questions. And I had set mine up in a little bit of a table so we could talk through it. I said, okay, where was it? Where were we? Well, we had the cheek, the shoulder, the forearm, the knee, and the hip. How big were each of them? So I read through the note and I plugged in the length of each one of them next to that. And then I said, okay, what type of closure were each one of them? Simple, intermediate, or complex? So you notice from my table I have 2 simples, 2 intermediates, and 1 complex. When you look at these codes in the CPT manual, they're grouped, right? If you do the bubble and highlight thing, they're grouped into 3 bubbles. And that is because they group different body areas together. And they'll say, oh, well, you code, the arms and the legs together. You code the face and certain parts of the face together, things like that. So as we scroll down, this is what I've explained. I've said, you know, for simple repairs, the cheek falls into the second bubble in your book, and the knee falls into the first one. So while we have two simple repairs, they're in two different anatomical locations, even according to the CPT groupings, so we have to have two codes. For the intermediate repair, the shoulder and the hip, both of those get grouped into the trunk or the extremities, right? My shoulder and my hip are both right off of my trunk before I go to the extremity. And for those purposes, for a repair, if they're in the same bubble, we add them together. We don't code for them separately. We coded for the first two separately because they were in different bubbles. But in this one, they're in the same bubble. They get added together. So we take the 7 centimeters on the shoulder, the 4 centimeters on the hip, we add them together to get an 11 centimeter laceration with intermediate closure, and we code the correct code for that. In this case, it's a 12034. And then we still have another closure left, right? We have one more, that complex closure. It gets coded all by itself because it's a different level of closure. So think about it this way. You know where all of them were. You've got to look at what was the level of closure, simple, intermediate, or complex. So look at all your simples together, look at all your intermediates together, look at all your complex together. And within each of those, do they all go to the same anatomical grouping for the codes? If so, they get added together. If not, they get coded separately. Okay. Scroll a little farther down because I don't know if I put any additional information down at the bottom of here. Okay, I put information on based on RVUs. If you're not familiar with RVUs, that's the relative value unit or the weight given to that code. Which one pays more, which one's worth more work. And according to RVUs, I listed the answers for you there in the order that they go in, right? And the complex repair is going to go first, and then you're going to have those intermediate repairs, then you're going to have those simple repairs. According to the guidelines, we also need a modifier 59. And that is because the guidelines say when more than one classification of wound is repaired, list the more complicated as the primary and the less complicated as secondary with the modifier 59. So actually what you would do is that 13121 would go first, and the remaining four codes, the 12034, 13122, 12011, and 12002, would each have a modifier 59 on them to show that they are separate and significant from one another. They meet different requirements and different criteria so that the carrier doesn't bundle them all together and say, you didn't build these right, right? So that's what, when we talk about those examples that you're going to see on the CPC exam and the practice exams, those are really repairs, and it's all about those three questions. What part of the body? How significant was the repair, simple, intermediate, or complex, and how long, the length of the laceration.